Heart health is so important, but many of us have no idea if we could be at risk. Here to tell us about aortic valve stenosis is Dr. Jeffrey Sell, Chief of Cardiothoracic Surgery at Sarasota Memorial Hospital. Doctor, it's a pleasure to meet you, and I am really honored to have you here, truly. I watched some tapes on you, and I know you have degrees from Harvard and MIT and Yale. So we're so pleased that you're here with us in Sarasota.
Well, thank you.
So thank you.
Thrilled to be in Sarasota.
Oh, great place, great place. Now, please tell our viewers about this procedure, the aortic stenosis, and what causes it. First of all, what causes it, and then we'll go into the procedure.
So there are a few causes of aortic stenosis, and apropos the name of the show, sometimes the aortic valve does not age gracefully, and it develops calcification, which is a hardening of that valve. It's designed to open and close. It's a very thin valve normally, and once it becomes stiff, it's very hard for the heart to pump the blood through that valve.
Where is that actually located?
That valve is right in your heart, right at the beginning of the aorta, which is the largest artery in the body.
Okay. Now, do you find that there are certain people that are more at risk for this?
So a lot of people as they age will get this just with the process of aging. Some people who have had rheumatic fever will get this at a younger age. And then there's some people who are born with a valve that's abnormally formed, and they tend to be the youngest people to get affected by it.
Okay. Now, how do you diagnose this? How would somebody know at what point they should come in and see? What are the symptoms?
Well, the first sign is a heart murmur, but a lot of people can have the heart murmur and it not be a problem. But then usually if a cardiologist sees a person with a heart murmur, they'll do an echocardiogram, and that can tell you exactly how well that valve is functioning. The symptoms of aortic stenosis, there are really three main symptoms. The first one is what we call syncope, passing out. You get lightheaded and fall over. The second is chest pain, which is like the chest pain you get if you have coronary artery disease, but it's still a symptom of the valve. And then third is shortness of breath. And it's important to know that aortic stenosis is a very dangerous disease, and that the survival rate of untreated symptomatic aortic valve obstruction is worse than most forms of cancer.
Oh my. Now, when you mentioned the three signs, would those necessarily happen all together or in a short period of time, or could you have one and not the other two?
Most people usually only get one. Some people will get two. What we know is that if you pass out, you have about 2 or 3 years to take care of the valve before is about how long you'll survive. If you get the chest pain, maybe 1 or 2 years, and with shortness of breath, most people don't make it more than a year without having something done to the valve.
Okay, now you have a new procedure. It's called TAVR. Could you tell our guests what that is? And it's a non-surgical option for
Correct. There's a procedure we do now for the aortic valve to replace it. In the traditional therapy for aortic stenosis is an open heart operation. We can go a number of ways to do that. We can open the entire breastbone, or we can make a small incision, usually on the right side of the chest, and go through there. But now we also have a way to replace that valve using a catheter. And we do that in conjunction with our cardiology staff, one surgeon, one cardiologist in each procedure. And we use a catheter that goes through any number of access points, most commonly the artery in the groin called the femoral artery, sometimes the artery to the arm, which is called the subclavian artery or the axillary artery. And this week we just for the first time used the carotid artery as a way to get the valve to its position.
Okay, now this is this is a new procedure.
It's been going on for about 6 or 7 years.
Okay, but you have a hybrid lab. Is there something that's special about that?
Yes, we have a very special room that's designed to be both a catheterization laboratory and an operating room. So anytime we have to do anything that involves manipulating catheters as well as surgery, we can do that. So we use that for special kinds of pacemaker procedures, procedures that we do the TAVR or a catheter-based valve. And even interestingly enough, I think we've delivered 6 or 7 babies there in women who've had problems with potential bleeding from the uterus after
Wow.
the delivery.
Wow. Now, obviously, you're the primary operating doctor in the
We
in the
actually
operating
have
room.
2 doctors, and we each have different roles, a
When you're-
cardiologist and a cardiac surgeon
Okay.
for the catheter-based valves.
All right. And what is the outcome on your patients? What are you hoping for when you
So most
operate?
of the time, these patients undergo this procedure, and nowadays most of our procedures are done under heavy sedation, not general anesthesia. They spend the night in the hospital, sometimes 2 nights, depending on where the access is to put the valve in, and then go home.
Really?
Yes.
And once they get home, what is their downtime at that point?
Their recovery is very quick. They're essentially back to normal at that point, already feeling better because they're not having the breathing trouble from the valve.
Okay. Now, you just celebrated a very special anniversary of sorts.
Yes, we within the last few weeks, we did our 1,000th catheter-based valve TAVR procedure.
Yeah. And what does the TAVR stand for?
Transcatheter aortic valve replacement.
Okay. All right. So how many of those 1,000 were you involved with, Doctor?
About 300, a little more than 300 of them.
That's amazing. That's amazing. Now, how many are on your team when you say there's you and the other primary doctor in the room?
So we have 4 cardiologists that do the procedure. We have 5 heart surgeons that are involved, and we all work together, selecting the patients, performing the procedures, and making sure that their hospital course is good.
Okay. All right. Well, thank you. And we can reach out to you at Sarasota Memorial Hospital for any more questions we have, correct?
Yes, ma'am.
All right. Thank you again for being here.
Thank you very much.
Thank you for joining us on Aging Gracefully, and find more episodes throughout the season on snntv.com. Join us next time for more tips on living a happy and healthier life.